Ayurveda is not only effective, but it can be safe if you get the treatment with the experienced doctors. And that is why I'm here.
Namaste, I'm Dr. Srijit. I'm Chief Physician of Pranavam Ayurveda Hospital. Here, I would like to introduce Dr. Milind Jani from UK. He's a surgeon and a urologist and practicing the modern medicine in UK since last few decades. Along with Dr. Jani, his wife, Dr. Asmita Jani, who is a renowned Ayurveda physician who has graduated from Jamnagar University of India. So I would like to introduce Dr. Milind Jani, since there is a lot of importance in this interview, because there are a lot of criticism against Ayurveda and there are a lot of controversies going on against Ayurveda during this period. So I would like to have a small interview with Dr. Milind Jani, since he has a lot of experience in modern medicine and also in Ayurveda. So I'm introducing Dr. Milind Jani. Hello, namaste.
Hello, namaste.
Yeah.
Thank you so much, Dr. Srijit. It's been a great privilege to come and visit you at your Pranavam Ayurveda Hospital and to meet you as well. And as you know, you were very highly recommended by Dr. Joshiji, Venkat Joshiji. Yeah. So I want to mention him here because we are all colleagues in this huge movement of Ayurveda. Mm-hmm. So as you rightly said, I am a trained surgeon, urologist, and but since 1989, when my wife, Dr. Asmita ji, she started and established the first Ayurveda and Panchkarma clinic in UK, and so I helped her, supported her. You know, again in UK there were a handful of Ayurveda, so as a modern medic, I was always very interested in Ayurvedic medicine. Yeah. So you might wonder, what is a surgeon and urologist doing, getting interested in Ayurvedic medicine?
Yes, yes.
But I trained in Ayurveda when I was training in medicine here in the 70s.
Oh, yeah.
From Professor Barot.
Okay.
With Asmita ji, and I used to go to the college and things. Just a brief introduction. Then I also visited Professor Sharma ji in Jamnagar. So a lot of interaction with Ayurvedic institutions in this.
Yeah, that's great.
Yeah. So I had a great passion, and one of the reasons why I was interested in Ayurvedic medicine is because I felt and I knew that it is a very deep science. Yeah. It was the original medicine 3,000 years ago.
Yeah. Almost 5,000
ago. I say 3,000 because then the Chara cancels, but it goes even further.
Yeah.
Maybe 5,000, 10,000 years. Who knows?
Yeah.
But practically speaking, it was the main medicine. And what a lot of us modern doctors, even around the world, not just myself, realize and have identified that there are many gaps in modern medicine in treating chronic diseases particularly. The acute disease, we know that the modern medicine is a gold standard. And, you know, we treat so effectively, you know, where we lack perhaps in the training in Ayurvedic medicine. So that was my interest. For example, you know, when you're doing urology, then I got interested in doing a research on the chronic irritable bladder. And there's no modern medicine, no chronic cystitis, which sort of, you know, is an autoimmune inflammatory conditions. There are many other urological conditions where you could do, like, you know, the stone and surgery and things like that. But there's just a few examples. But then when I started doing a little bit of general practice, there we saw, you know, like rheumatoid arthritis, a lot of musculoskeletal problems, osteoarthritis. That's right. But the biggest was the mental health, the mental stress, and there is really no effective treatment in the West. They all give all these antidepressants, and there were a lot of side effects.
Sedatives.
They can only control. So my interest was that, you know, with modern medicine, we only control the disease, we suppress the disease, and you have to take it for a lifetime. And then Ayurveda offers such a huge option, right? So
I'm happy that yours was the first Ayurveda Panchakarma center in UK, that too in 1989. It's, you know.
Yes, and then we progressed. Thank you. And then we progressed when we partnered with Mr. Gopi Warriorji, who I must mention because he was probably the first patron who invested so much in the Ayurvedic company of Bravery. He invited us as our clinic to be part of theirs and help. And that's why I was the first director there. And then we did a lot of campaigning with the government because he was quite influential in promoting Ayurveda, getting it recognized as a medicine. So there were a few doctors. And we will come to the issue of criticism in a short while. But that is where we then treated, Asmita and I, we were doing this private practice because we couldn't do it in NHS. But I was bold enough, as in a general practice, to incorporate advice to the patients that they should. I used to teach them, first started with pranayama, breathing for asthma or anxiety, said go into yoga. And then I said, try some simple Ayurvedic herbs, like the ashwagandha and brahmi, shatavari. It was just an introduction without doing a huge assessment. I know we have to do the proper course and everything. But try and introduce these concepts that there are other options. Even simple things like drinking ginger tea, for example. A lot of people don't know that ginger actually is an antidepressant. They don't realize that. And there are sort of ingredients in this sort of thing. So just a few simple examples here rather than the complicated. And so I started slowly advising them on that. And also between Asmita and me, we treated rheumatoid arthritis. We were doing complementary supportive treatment with cancer patients.
Oh, that's fine.
And I can give you an example with Asmita. She was trained by Dr. Kasture, the great Professor Kasture. So her knowledge was just absolute, And so just to give you an example that she has treated women who were not conceiving. And with her treatment, within 6 months or within a year, the women conceived and had absolutely. And we even had one who was told that she's got premature menopause, 26-year-old girl, put on the HRT and all that. And I said to her that, no, it shouldn't be, let's see. And we treated her as well. And 6 months later.
So all these were with the help of
Ayurvedic medicine and Panchakarma. I must emphasize that I think we found that just consultations with Panchakarma and medication, like, Charaka said, Ayurvedic medicine also is only 20% of the treatment. The rest is, of course, the Dincharya, the Panchakarma,
the lifestyle programs.
And also getting people to change that. So the way we changed the public, so we made this a public-driven shift in healthcare. So we did loads of workshops, talks in the communities. That's how we promoted. You see, if you change a culture.
That was a great initiative, especially to promote Ayurveda in UK and this. So we really appreciate that.
Thank you so much. And we thought that we were paving the way for the future Ayurveda produce. That has been our passion. And so we established the first British Association of Accredited Ayurvedic Practitioners. That was my initiative with Gopiji. Because my whole idea was that this handful of Ayurvedic practitioners, they were doing other work, if they wanted a credibility, and like you said, the criticism, there are physicians who are going to treat people. That's what we were doing, protecting the image of Ayurveda as a medical system. That has been my main thrust, Because otherwise, in West, they will often train for 3 months or 1 year, and it's not a criticism, it's just that, and then they would start practicing, calling themselves Ayurveda, and people would respect them more than the Ayurvedic physicians who are properly trained. So that's what we were doing. And
so 2 things I would like to clarify. So, so Dr. Asmita has a legacy of almost 35 years of practice in Ayurveda. So now there is a lot of awareness for the people about health and even various types of medical system. So that is another one point where people are getting confused. So which system should be adopted for which type of disease, and there is definitely a lot of confusions going on because people have a lot of health awareness. At the same time, they are much confused to choose which system in which disease. So in your history of almost 3 decades of practice in Ayurveda, so have you experienced any side effects with Ayurvedic medicines or even with Panchakarma treatments?
So Asmita and I have not experienced any serious side effects. That's a fact. No serious side effects.
In last 35
In
years.
35
so
years,
it's
so-
a big course.
Absolutely. We have experienced which is bound to happen. Sometimes if you give Ayurvedic herbs, like I give you example, there was a doctor colleague who was very interested in Ayurvedic and medicine, and she had digestive problems, and Asmitaji assessed her fully with that. And, she said that the right thing for her with huge vata and all the panavayu and what have you, with hing was the churna, which we would know. And this lady got so much abdominal pain, intestinal pain.
Okay.
And then she later on found out that she was allergic to some of the ingredients, the black pepper or the tricot or whatever.
Yeah, but even then I think that it is a very minimal side effect because
Absolutely.
but in allopathy there is a lot of anaphylaxis happening, a lot of side effects with the drugs. Even with every 100 patients, the percentage of the side effects and reactions are very high.
Massive. And that was the other reason why I have been interested in Ayurveda, other herbal medicines as well, complementary medicines, like the marma therapy and the acupuncture. I did a diploma in acupuncture for 2 years. And Asmitaji and I mapped out the marma points and the nadis and the doshas way back in 94.
Oh, yeah.
We published in the West, we're doing that. So the reason for this is to reduce that there is so many side effects of modern medicine, whereas with Ayurvedic medicine, it's not that Ayurvedic medicines are not free from side effects. If not used properly, even Charak has said that it can be poison.
Yes.
So which means that you have to use them properly. So the two main points I would really say is what we have been saying is that firstly, the training, the proper training of the Ayurvedic doctors who work either in India or in the abroad or the UK. It is the practitioners who spell the name of the Ayurveda.
Not the Ayurveda.
It is not the Ayurvedic science which is deficient. That is a complete
lack of training and also lack of knowledge.
And I will tell you this, that I gave the book, I was working with our professor of cardiologist at that time, because I was this and and I said, look, I want to do some more research, and he read the book, and then we were discussing, and he said, English professor of cardiology. He said, Milind, this is a very sophisticated medicine. I read it, and there's so much potential, but it would take me a long time to do that. So, so even the Western doctors know that there is a huge depth in this. It's just because they don't understand it because of the language. And again, we represented, I was a lead in representing our Ayurvedic community with Lord Wharton's committee in 2003 when they said, that we don't recognize Ayurveda. And that campaign is still ongoing. We've worked very hard for 20 years. We're still going now. There are a lot of other good, experienced Ayurvedic doctors since then. They used to come and take mentoring from Asmitaji and myself. They're now set up 2 or 3 colleges there in Ayurveda. And so it is becoming more recognized. With around the world, like in USA, like Mercy Deepak Chopraji and Vasan Larji and many others, Bodhajin, Western, they have done a lot of work even in Europe, Germany, and I'm in contact with all these people. And as I hosted one of the annual Ayurvedic conferences in Leiden, in Netherlands, at the High Commission as well. And so what I'm trying to say is that we have done, other people have also now done a lot of work. So Ayurveda is becoming not only popular, but people who have done treatment. Western people come to India to good centers.
A lot of people.
They aspire that. So now around the world, people are learning that Ayurveda is not only effective, but it can be safe if you get the treatment with the experienced doctors. And that is why I'm here to visit your center, Pranavam, and you know that I came with my son, and he will talk separately about that. But I was very stressed out as well. And with my diabetes, I have been treating myself with yoga and Ayurvedic medicines. So you can see that at 72, I'm not bad. It's Ayurveda, and I haven't fallen ill other than 1 or 2 things here or there. So we do need to take care about informing and educating the public and the modern doctors, even in India, about how they can maintain the safety of Ayurvedic prescribed medicines or the medicines which people take over the counter, which are of poor quality. So the 2 reasons why you get serious side effects from Ayurvedic medicine, like liver disorder. I think it's the contaminants. They did a study of this in the USA because it was increasing there. Small numbers.
Due to the poor quality of the medicines.
And contaminants.
Contamination also.
In India, you know that. So I'm here now exposing a lot of this over which I have researched over the years. And they found that there was really actually impurities and contaminants which were causing the
Also, there are a lot of people taking medicine without any logic,
Correct.
They go to the counters, they get the medicines and sell, decision. And a lot of people are getting different medicines and they continue for a longer period of time, which is actually not required. So that's also damaging the liver or kidneys.
Absolutely. And
I would blame Ayurveda on that, perspective.
And the high dosages. Like giving you example, for example, everybody now taking ashwagandha, which we actually started first in the UK. But with ashwagandha extracts and the high dosages of 1 gram and 3 gram, and they're not sticking with that. And that is why they find that it might affect the liver enzymes and liver. They also, for example, Bacopa monnieri, and there are lots of research in the last 20 years. So I would suggest that doctors refer to WebMed or ResearchGate or some useful, resources where lots of research has been done. And authentic research, even in India, in the institutes, the All India Institute of, Ayurveda in Delhi and Bangalore. And they should see those research. And so there can be side effects like Bacopa monnieri. If you take it on a high dose, it can cause a liver elevation of liver enzymes and even a little bit of a jaundice, perhaps, depending on its variety.
It's all conditions. It's always subjective.
So Charak hasn't said, Ayurveda doesn't say that there are no side effects. That is why we have the Dravya Guna. That is why we have the Paishajya Kalpana.
Also we have Dasavida
Pariksha to identify.
To analyze the constitution of the patient and how to, prescribe a drug, on which person, what time of the day, also, condition of the disease, like that. So many factors are there.
So that is from the practice point of view. And from my understanding, the way that I have promoted it is that Ayurveda has got two parts. One is the layperson's Ayurveda, and the other one is the professional's Ayurveda. This is where the Vaishya Kalpana and the preparations, standard preparations like the Saraswat, or when we were using Mahayoga Rajgugar for rheumatoid arthritis in the patients we were treating, along with the other, like Boswellia, but also with Panchakarma and Shodhan, and trying to do the so that it doesn't have side effects on this, with their...
So when used properly, definitely Ayurveda medicines are very safe and, it is very good for even long-term application, but it should be based on a logic and it's highly subjective. It is highly depending upon the constitution, the disease condition, the age, gender. A lot of things are, really related to, prescribe any of the Ayurvedic medicines.
Absolutely. So talking as doctors and professionals, that's what we would emphasize. That there is a huge laypersons Ayurveda. Everybody in India uses, like Triphala Churna or Ashwagandha Churna, or they might use Avipattikar Churna. So what we have done over 30, 20 years, this is what we were saying, that we created a list of the safe, like the Shatavari for the acidity, a little Brahmi normal, but we use Central Asiatica rather than Mandukpali rather than the Bacopa, because that's less. So all these for stress, they made their signs. Then we started combining the Ashwagandha Brahmi for over the counter. This is where the supplements came in. And then you give the instructions for the warnings and alertness, how they should take it and how they should not take it on that. This is what we went. That is why this whole thing has got. So it is important also for, very experienced Ayurvedic doctors like yourself and others and in your association to create these public education forums that they can use over the counter, if I understand correctly, because they all do that anyway. But how can they do it safely? That is the important bit. Okay? Even if you don't know understand your general constitution, how to understand your prakriti, it's not difficult. You can decide whether, and your dosha, if you've got a lot of ama or toxins, you'll always have that. So how to choose simple Ayurvedic medicine or simple formulations.
Our associations are, trying to propagate and also to spread the wellness or the good aspects of Ayurveda to the public. Through seminars and medical camps. We are trying to do that. We are in that process.
Perfect. Well done. And that is what we'll... So I wanted to share that's how we changed the shift. We educated the public first to use Ayurvedic herbs and things, and to do the pranayama, do the abhyanga, do the head massage regularly, make sure the diet that you take accordingly. Yes, and you try the sort of nirama diets and how to do those fastings to make sure that you cleanse. So we brought this awareness of using Ayurvedic principles at home for the person, how to keep the nirama state, so prevent those toxins, how to prevent illness by using not just the Ayurvedic herbs, but even simple teas. And that's why we created those Ayurvedic teas. That was our idea. Nobody was doing it because they are simple. Like we did a blend of Vata tea. We added Brahmi Tulsi with chamomile, which is chamomile flowers are very good for calming the nerves, but they are sweet. They're also good for digestion. Then a bit of ginger and lemon balm, right? So with those sort of things like cardamom, so you have a digestive with it, and then you have this simple Vata balancing mind, calming stress. So they are so easy for people to use. They are like our Fanta, fun.
So how do you think that Ayurveda is, very much important in current lifestyle of for the people? And, people are ending up with a lot of diseases, and especially cancer and, a lot of new generation diseases, which are even not curable or who have idiopathic reasons. So how do you think that, how Ayurveda can help to either, help those people, or how Ayurveda can help the new generation people?
Very good question. And this is the reason why I am into Ayurveda, right? If we try and keep it simple, like, the mental health and stress, people can prevent that by learning the Dincharya. And learn the pranayama and the yoga, because once they have the discipline, even Western motivational speakers are saying, if you create a routine, if you create a discipline, then half of your stress will be reduced. Then you will be able to break it.
We'll be able to
manage it. Yes. If you add your pranayama, meditation, dhyana, like, we said the Atma Semanasisa. So that is why so many people in the West, that's why yoga has become so popular. Meditation is becoming so popular. Kirtan is becoming so popular. All that is part of Ayurveda, isn't it? So Ayurveda can help people easily adopt this lifestyle, but also to understand how their minds work and how to balance, how to maintain that equilibrium, both in the mind, through the mantras or chanting and things. And then you bring in your simple Ayurvedic herbs, like I said, the Medya Rasayans. That is why my main sort of interest in those. And of course, we assume that we'll also help them, go and have an assessment and do their doshantriks. But people can simply use those without using the strong antidepressants like SSRIs, Prozac and citalopram and sertraline. They all have the side effects. After long term, when you withdraw, you'll have issues. And they don't completely actually cure you of your anxiety, depression, or anything. It just continues. So I think that if they adopt Ayurveda, with that they can then continue when they've learned their, non-pharmacological methods like the meditation, dhyana, yoga, etc. Then they can do their regular, abhyanga and the Shiro Abhyanga. So we have taught a lot of people do it at home yourself. So these things
like this.
These things can be actually taught to the doctors, the modern doctors, to teach their patients so they can help themselves. So our motto is empowering the patient to take control of their health. So, because Ayurveda emphasizes mainly on prevention. Prevention.
Where you can also incorporate the ideas and principles of Ayurveda to help people with a very healthy life. Because Ayurveda is mainly focusing on prevention. So, tasya swasthya rakshanam madhurasya roga prashanam cha. So, main aim is to prevent the disease.
And also tasya swasthya rakshanam. First preserve that first. And that is why I think that Ayurveda so the way that we teach is that it can give very simple methods. People can learn it around the world, and they are learning it.
Yeah.
That's why it's really now increasing everywhere with new training. So in the last 15, 20 years, there has been a huge thing with like Dr. Joshi ji, ourselves, and because, we started the first training course at Thames Valley University with Dr. Gopiji.
Yeah.
That was the first initiation. And then he also created a hospital and things like that. So now, even in Europe, with the European Ayurveda Academy, there's Australian Ayurveda Academy, in Russia and France.
Yeah.
So the reason why people are realizing and becoming aware that Ayurveda can help is because they realize that Ayurveda is a complete system. It's a proper medical healthcare system. Yeah, but it's a proper medical system. It has a holistic basis, not unlike modern medicine. And all the other complementary medicines, like people might do, like Tai Chi or acupuncture or Pilates, or that, they are all good, but they form pieces, little pieces of the only complete whole medicine that they can get is only Ayurveda. And it's a well-established track record of that. It's like the sister medicine of modern medicine.
Yeah, that's a great thought, and thank you.
This is how we need to promote it.
Yeah, thank you.
But good training.
Yeah. So I really appreciate you, and thank you so much for all your thoughts and your passion and interest towards Ayurveda is so appreciable, and thank you so much.
Well, thank you, Dr. G. You say that, thank you for those kind words, but I will say to you as well that thank you for letting us visit you and see your work. And it's doctors like yourself who practice ethically, authentically, and scientifically, with making sure the safety of the patient is ensured, and that you assess them properly. And so that is why, we are always very grateful to meet people like yourself, so we can then, spread the word.
Thank you so much, and take care. And
pleasure.
Looking forward to you.
Yes, and we will continue. We hope to continue our association and collaboration for promoting Ayurveda.
Thank you so much.
Namaste.
Well done.